Cognition, language, and intelligence. So what is cognition? So cognition is the mental action or process of acquiring, storing, and retrieving knowledge, and this is through thought and experiences. So the brain is endlessly perceiving, processing, planning, organizing, and remembering. Our brains are always active, although this goes unnoticed through most of our daily routines. So scientists who are studying cognition are searching for new ways to understand how we are constantly integrating, organizing, and utilizing our conscious cognitive experiences without being aware of how our brain is working unconsciously. So, how does cognition change as people age? This topic is valuable to my personal growth because it allows me to learn more about how people's cognitive functions change as they age. As a nursing student, it will help me care for my future patients because I will be better able to understand their cognitive abilities. And it will help me realize why my patients are acting the way they're acting and why they are making the decisions that they are making. So I found 2 articles. The first article was the cortical structure of functional networks associated with age-related cognitive abilities in older adults. And the second article was tracking cognition in nursing home residents. So the first article, some of the main points I realized throughout was that cognitive neuroscience of age links well-established effects of aging on cognition to the effects of aging of the brain and structures of functions. Cognitive-related networks such as default mode control, dorsal attention decline during aging. Age is related to a decrease in brain volume extended beyond traditional cortical proliferations. One study found that a relationship between cortical surface area and episodic memory task performances. So this study looked at 235 community-dwelling adults. They were all right-handed and scored above 23 in a mini-mental state examination and had no MRI contradictions. The participants went for 2 sessions of cognitive testing and 1 of neuroimage testing. Cognitive tasks were selected related to age-related decline in long-term memory, processing speeds, and executive function. Results in the relationship with age, the cortical thickness based predictions of cognition were significantly related to the age of all 7 networks, and the average cortical thickness across the entire cortex was negatively associated with age. This is important because it shows that the cortical thickness of the brain, which is the brain's morphometric measure used to describe the combined thickness of all the layers of the cerebral cortex. And this affects cognition in a negative way. This article used functional network maps to learn and process information differently, and the article shows that there are negative effects of aging in the relationship. The second article was about tracking cognition in nursing home residents. So I found out that approximately 50% of cognitive impairments in nursing home residents are not well understood. And cognitive impairments occur in 95% of nursing home residents, and there are significant weaknesses in diagnosing it and managing it. So age is associated with lower scores on the mini-mental state examination. Some nursing home residents show cognitive improvements, actually, after acute medical events, such as falls, delirium, and surgery. So for this study, a series of independent t-tests were conducted to analyze the relationship of declining and inconsistent performances on the cognitive performance scale at baseline activities of daily functioning and a number of medical diagnoses and a number of prescribed medications. For residents with diagnosed dementia, the intake was 6 exhibited and they declined in performance, and 2 actually had increased performances. 7 stayed at a stable performance. And for residents that were not diagnosed with dementia, 3 had declined performances, 4 had increased performances, and 11 had stable performances. So the average scores on the mini-mental remained relatively stable, and the results remained despite half of the sample being diagnosed with dementia. Residents who had poorer overall CPSs scored had a greater number of medical diagnoses, and they were prescribed more medications than the others that were observed. And it actually indicated that residents with a poorer overall health at the admission were more likely to exhibit sharp declines in cognitive and in a relatively short amount of time. So the results of the study indicate that cognition in nursing home residents may not decline as sharply as we previously thought. Contrary to expectations, the cognitive performance of a majority of residents comprising the current sample either increased or remained stable after the first mini-mental examination, and they didn't decrease after the baseline performance. So how do these studies affect my professional career? So both of these studies help me as a nursing student because they give me a better idea of how nursing home residents with dementia or without dementia, as well as people aging in general, have different cognitive abilities. Generally speaking, everyone has a different level of a cognitive ability, and everyone is capable of learning and processing information differently. So these articles show the negative effects of cognition as we age. This is also important to my career as a nurse because as a nurse, I would be the person who would be performing the mini-mental examination with the patient, as well as doing CAM assessment tools, and I would not be the one diagnosing them with dementia or anything like that, but I would be the one performing the care for them, and this the knowledge of their cognitive abilities would allow me to care for them in different ways and make sure that they are receiving the best possible care for their specific conditions.